So our sports chiropractic service is our primary clinical service, and what we do in those sessions is a combination of taking a thorough history, understanding the person in front of us and their goals. We run through an orthopedic neurological assessment as well as a functional assessment to really get a good idea of what's driving the person's pain. From there, we typically will sit down and discuss what's going on and find out the goals, and then start to piece things together a little bit so people can see where they're at and how we're going to get them to where they want to be. We'll typically use hands-on treatments, so we'll use soft tissue work or dry needling or manipulation as tools to help with their pain and improve range of motion and general function. But most importantly, we follow that up afterwards out in the gym space, where we actually run people through their exercises and give them an exercise program that is practical. We actually have an exercise app that we use, so people get access to that and they can follow the exercises there. And that starts the clinical process of their healing, their recovery, and ultimately their journey to rehab success. Usually the way it will work in the clinic is we write somebody a program, and they might have that for up to 3 to 6 weeks. We use our hands-on care through that process just to help support the painful areas. We use those treatments to touch base and make sure that they're progressing well. We update things, we address any concerns along the way. So our steps to success pathway is the steps that we use to guide people from being in pain to returning to full function and achieving their goals. So the first phase we call the protection phase, and that's usually when people are in pain, they're limited by range of motion. The last step is what we call back to your best, which is ultimately the final goal of where we're trying to work towards. And we have steps in between that progressively build up the rehab. It builds up from light loading and range of motion into strength and reintegration into sport or physical activity. And that process ultimately allows us to stage our rehab in a progressive manner that allows the body to adapt really well and ultimately creates a clear path to rehab success for the patient. So if you've struggled with pain or injury, if you're confused about what is actually going on, or you feel like you haven't been heard by your previous practitioners, we're probably the place to be. We spend the time to understand that, and we take great pride in our interactions with our patients and the process that we run them through as well. So if you feel like anything I've said has resonated, then call us, book in, we'd love to help you.